we are going to talk about a very interesting topic, which is weight gain during pregnancy. What's normal and what's not. And with me, we have today two experts who are going to share their insights with us. But before that, I would like to tell a little bit about Baby Chakra. So, Baby Chakra is basically a platform which talks about parenting, motherhood, and the daily struggles that new parents face. And we as a platform try to empower these mothers and parents, and also guide the parents through their process. Other than that, Baby Chakra also has some very natural products, skincare products, and a lot of baby care products on the platform. So do check out. Now we will move to the live. And yeah, I'll just repeat the topic, which is weight gain during pregnancy, what's normal and what's not. So, to begin with the live, we have a question, which I will request Dr. Archana to take it up. So, Dr. Archana, the question is, what is unhealthy weight gain during pregnancy? Could you please tell us?
Hi, Reema, and it's a privilege to be on this platform. Hello, all the viewers. I'm Dr. Archana Shah. I'm a high-risk pregnancy expert and a laparoscopic expert from Ahmedabad. I'm also the director of Sanidhya Multi-Speciality Hospital. You can also follow me on my Insta handle, that is Archana Shah 20. So now coming to your question, what is the unhealthy weight gain during pregnancy? So to understand unhealthy, first we need to understand what is a healthy weight gain. So
Yeah.
healthy weight gain for a normal person in the pregnancy would be around 11 to 15 kg. So if the baseline body mass index of that patient is around 20 to 25, then she should gain around 11 to 15 kg during her pregnancy. If the woman starts underweight, her pregnancy, when she's starting, she's underweight and her BMI is less, then she has to maybe put on more weight. So, approximately that would be 18 to 20 kg. And if a woman is already overweight when she is starting with the pregnancy, then she has to put on less weight. So, maybe less, less than 10 kg. So, this is the normal weight gain. Anything deviating from this would be unhealthy.
Thank you, Dr. Rachana, for that insight. So basically, it all depends on the weight that the mother has pre-pregnancy and how she progresses during her entire pregnancy journey is what is the base. Okay. So, Dr. Pooja, we have a question for you, which is, when should an expecting mom be concerned about weight gain during pregnancy?
I'm sorry, Reema, can you repeat your question, please?
Yes, yes. So the question is, when should an expectant mom be concerned about weight gain in pregnancy?
Okay. Now, this is very nicely what Dr. Archana said that, weight gain is in a bracket of 9 to 13 kgs. Okay.
Yes.
So, an expected weight gain would be around the second trimester, when you say around the fourth month, where the baby, growth is also starting, is progressing, and the mother is also having some food cravings at that point of time. From the nutrition point of view, she likes to eat different kind of food items. So fourth, fifth, sixth kind of the month is where she can nurture her self with good nutrition, with the appetite, with a good appetite. Also, she has to have a control on what she's eating. So small and frequent meals is generally what we say, but healthy homemade balanced meals is the key to this question. And if she progresses in a very nice way, definitely the weight gain will be within the limits.
Sure. Thank you, Dr. Pooja, for the wonderful insight. So moving on to next question, which is for Dr. Archana. Doctor, would you tell us what are the foods to avoid to gain too much weight during pregnancy? What would be your recommendations?
As Pooja mentioned, that the women should have a very balanced meal. So,
Yeah.
small, frequent meals and healthy meals. So, they should avoid junk food, outside food, especially those burgers and chana puri and pav bhaji, all that. It should be a very complete and balanced meal. If a patient is prone to eating outside and lot of junk food, lot of wafers, she is going to put on unhealthy weight. So the balanced home cooked meal, which should include the dry fruits, the vegetables, especially the raw vegetables, salads, and a good amount of protein and dairy products. That would form a complete wholesome meal.
Sure. Thank you. So, Dr. Archana, adding to what you said, so I mean, we commonly hear about those pregnancy cravings, and considering that, a mother, like an expecting mom before this, was leading like quite a normal, not a normal but a regular life, where she was not used to worrying about what food she should eat and what food not to eat. So like in our regular lives we are used to eating junk, or a lot of these foods. So how does that transition, can happen? Like, is there any suggestion on that how a mother can adjust to that? Because there might be some mood swings also, like she's craving and all that. So what would you tell
See,
about?
cravings are normal in pregnancy, and to go for those cravings are also normal. So once in a while, maybe once in 7 days or 10 days, if a woman is eating junk, that is fine. But she needs to balance the rest of the days with a balanced meal. And the other important thing is that the patient should not think that she's eating for two.
Hmm.
It's not you're eating for two. It should be what you're eating, the quantity and the quality matters. So you should be eating healthy. I usually recommend to the patients is, see, you are giving birth to a new child. So yes, you can indulge to your cravings, but also the rest of the days try to eat healthy, balanced meal.
Sure. Thank you, Dr. Archana. That was, I'm sure that will help a lot of moms and make them feel positive through the journey. Um, so moving on, Dr. Pooja, we have this question, which is, why do some expecting moms gain weight really quick during pregnancy? So what would you say?
Uh, as Dr. Archana also said, and as research also says that overweight is one of the concerns, right? There could be maternal obesity would be one of the factors. The weight gain in the early months could be due to a lot of stress. It's not always eating. It could be due to stress. It could be due to many other several factors. But what we are looking for is a sustainable weight gain. A mother who gains 4 to 5 kgs in the initial first trimester and then doesn't gain weight over the next few months is not what we require. She should go very slowly and very steadily for the overall growth and development of the fetus to happen. There could be indicators that due to thyroidic condition it is there, or due to maternal obesity which is already mentioned, or it has been hereditary. The factors are need to be identified, and it is really one on one. After a talk with a gynecologist only the reasons could be found out. But if the mother is too much into stress and she's not known about her pregnancy, and she suddenly sees that her weight has jumped from suppose x number to another number over the last few months, which she's not even aware about, then that is a matter of concern, and then she needs to take a help of a expert. This is what I feel, and in this journey it is very beautifully understood that the mother, uh, to be mother, has her own concerns as well, but priority wise she may not take health, look at her health in that perspective. So that is a thought that we need to understand and give it behind. Over to you, Rima.
Sure. Thank you, Dr. Pooja. Dr. Pooja, so like we did talk about moms gaining, like, that is a concern. But like, what about those moms who need to actually put on weight? Like, is there any suggestions like how they could manage to do that?
Right. Yes. So when we see the 9 months, we divide it into three phases: the first trimester, second trimester, third trimester. most of the mothers may have nausea, may have fatigue, may have tiredness, may have morning sickness as a problem. And these are the early pregnancy symptoms which most of the women face. And it is very natural and it is very common. And even Dr. Archana would agree with me that most of the mothers complain that I am not able to eat well. I am feeling very pukish in the morning and my weight gain is not happening. So is this going to hamper my growth of the baby? Right, Dr. Archana?
Yeah, so first trimester, usually patients don't gain weight. Some might
Yes.
even lose 1 kg weight, so that is normal.
That is normal. And in this, when we are talking about sustaining a healthy kind of a diet, what as a nutritionist, what we recommend is go for small dry snacks. So either if you are in the early morning when you wake up and you have that nausea and you're not able to enter into the kitchen, fine, keep a biscuit packet near your bed, have some toast, have some kharik, or khakra, which will help you to slow down your metabolism, make you comfortable, and then you can proceed in your day ahead. So in this, likewise, the things can happen. And as you can speak with your doctor, she might also give you a medicine if required, or you can speak to your nutritionist who can plan your day very very beautifully. See, every mother has a very to be mother has a very different kind of a routine. And when we talk about what to eat, I would say keeping a fruit in your bag, going on liquids like buttermilk, or having a plain coconut water is something doable and which is accountable also. So you need not be worried कि अरे मैंने आज कुछ नहीं खाया है. What do I eat now? Go for small meals which give you energy, and this will definitely help you to pull your day through.
Yes. Thank you, Dr. Pooja. I'm sure that is really helpful for all the expecting moms out there who might be concerned about weight gain during pregnancy. Um, Dr. Archana, earlier we did talk about the unhealthy weight gain during pregnancy. So, like you did talk about the body mass and all of that, like depending on the mother's weight pre-pregnancy and all of that. So, where considering that she should be gaining a certain amount of weight, and for a healthy pregnancy, what would you say that how much weight does a mother lose when she gives at birth? So like how does it work, and how what factors does it depend on?
So you'll be surprised. Usually, patients once they deliver, they try to weigh themselves, and they are surprised that there is no weight loss, even if a 3 kg baby comes out. So we need to understand that this the weight gain is not only the during pregnancy. The weight gain which is happening is not just because of the baby. The weight gain is also because of the placenta, the amniotic fluid, the whole body where the uterus enlarges, the breast enlarges, the fat gets deposited in their entire body. So, all that weight gain is still going to be there immediately after delivery. The fluid retention is going to be there. So, surprisingly, once immediately after delivery, on discharge, if the patient jumps on the weighing scale, her weight is only going to reduce by half or 1 kg.
Okay.
Then, slowly, gradually, the pre pregnancy state the woman achieves is after 6 weeks. That is the puerperal phase or the postpartum phase, which is 6 weeks. In India, we also do the sawa mahina, जो डिलीवरी के बाद सवा महीने पालते हैं. So the body gets to the pre-pregnancy stage. At that time, maybe the patient loses around 3 to 4 kgs only. The patient regains the pre-pregnancy weight gain after almost 6 to 9 months because the patient is also breastfeeding. So her breast enlarges, so that weight is going to remain. After 6 to 9 months, the patient starts weaning, so the lactation decreases, and slowly, then gradually, the weight decreases. So the famous example is Kareena Kapoor. So Kareena Kapoor did not lose the weight in 1 month. She took
Yeah.
almost a year to lose her weight, even Aishwarya Rai. So these are so the healthy weight loss after pregnancy is average 6 to 9 months. And after 1 year of delivery, the patient can regain the pre-pregnancy weight.
Sure. Thank you, Dr. Archana. That was very helpful. Um, so, Dr. Pooja, we have one last question, which is what are the symptoms of unhealthy pregnancy?
Symptoms of unhealthy pregnancy.
Yeah.
Okay. With me being a nutritionist, Dr. Archana can also add her points being a gynec over here. From the nutrition point of view, I believe that if a mother is not able to eat well, she is not able to keep up to her daily routine. Number one, she has excessive of vomitings, excessive of nausea, fatigue, tiredness, worn out by the end of the day, having low hemoglobin. These could be understood as, unhealthy pregnancy symptoms. But if Dr. Archana can share a few insights, that will also be very helpful. Dr. Archana, over
So
to you.
when we are discussing today about the healthy weight gain, so basically, if a patient is not gaining the optimum weight, her baby is going to be IUGR or intrauterine growth retarded and low birth weight. So that is unhealthy for the patient. If a woman is gaining excessive weight gain, she is prone to pregnancy-induced hypertension, which is again a serious condition. It can be serious for both mother and child. She is prone to gestational diabetes. So again, which is dangerous for both the child and the mother. And the important other thing is if a mother gains abnormal weight gain, the baby is prone to childhood obesity. See, again, India is also now fighting for obesity. The non-infectious diseases which we are fighting is one of them is obesity. So if mother's
Yes.
weight gain is unhealthy, the baby is going to be prone to childhood obesity. So this in future that baby would be then overweight. The seeds are sown during pregnancy, as they say. So we need to have an optimum weight gain in consultation with the gynecologist and the nutritionist. What is the baseline of the patient? Accordingly, we recommend that this is a healthy weight gain during pregnancy, and the patient should aim for it.
Sure. Thank you, Dr. Archana, for those wonderful insights. I'm sure it's going to be really helpful for the viewers. So that brings us to the end of the live session, but we do have some questions from the audience side. One of the questions is what is gestational diabetes that Dr. Archana was mentioning? So, would you please tell us about it?
Yeah. So gestational diabetes is the patient to start with is not diabetic, but as pregnancy advances, usually around seventh or eighth month, patient starts developing the glucose level starts increasing, and she goes into gestational diabetes. So as the name suggests, gestational diabetes, the high sugar levels are because of pregnancy. As soon as the patient would deliver, her sugar levels would come down. Gestational diabetic patients would put on more weight, would have high birth weight babies. So they are more prone to operative deliveries, and the babies would have macrosomia. Then post delivery, also the babies can develop this sugar issues. The post delivery, the baby can go into hypoglycemia. So that is the reason we screen all pregnant patients for gestational diabetes at around 7 months.
Sure. Thank you, Dr. Archana. That was really insightful. So, Dr. Pooja, we have another question. So, the question is how does a mother who has delivered through C section, take care of her weight and well being post her delivery? So,
Right. So after delivery, the post weight loss is
yeah,
a remarkable question for everybody. But at the same point of time, you have to understand that you need to give time for yourself. Number one, as Dr. Archana also mentioned, that the first 40 days of confinement is a must in terms of taking care of yourself and the baby. Number two, when we are eating for ourselves and the baby. So first 6 months is exclusive breastfeeding. WHO also recommends that the mother should be feeding the child as per demand. And for that, our nani and dadi have been following various nuskes, and nowadays the mothers are more diet oriented, conscious about taking extra ghee, extra fat. But what we are understanding is that that is helpful nutrition for the baby's growth and development. Though you want to restrict it, okay, limit the quantity, cut down on the portion size, but do definitely have, because they are natural galactagogues. These, in the western medicine terms, they are known as herbal medicines, and they are very, very useful for breastfeeding. Third thing is, what we have to understand is, the weight loss cannot be sudden unless and until want to get back in shape, trim and slim. Without exercise, nothing is possible. So once you get a green signal from your doctor saying that your stitches are fine, whether you had a normal delivery or a C-section delivery, unless and until you don't get a signal from your doctor, you are absolutely fine. Do not perform any kind of exercise because it might be harmful. But yes, you can go for small and steady walks, which can be like after your meals, or do some yoga poses with a help of a yoga practitioner who can allow you to get back within a period, in a stipulated period of time. So slow weight loss will happen only when you have a good exercise routine, you're eating well, you have a good sleep, you have a good hydration, and you are following your doctor's guidelines also meticulously. In these manners, the weight loss can be achievable. And give yourself time. Mentally, I believe that all moms need to follow this. Allow the time to seep in, and most of the moms complain of, I don't have a time for myself. So slow down, and that's where you get your answer.
Sure. Thank you, Dr. Pooja. That was really, insightful and obviously very positive for moms. I mean, they shouldn't pressurize themselves to like drastically change over a quick period of time, because they invested almost, they dedicated 9 months to a process. And obviously, it's going to be different for every mother. So they must care for themselves and the baby and just like take things slow. So yeah, that's what I would add as a concluding statement. Before we wrap up, Dr. Archana, is there any closing words of advice that you would want to give to the viewers?
My closing advice would be, don't be afraid about the weight gain in pregnancy. See, sometimes patients, when they are coming every 15 days in the second or third trimester, Madam, I've put on 3 kg. Madam, I've put on 4 kg. So don't be afraid about the weight gain in pregnancy. Weight gain in pregnancy is going to be there. Go for a healthy weight gain. So, healthy weight gain is important for both your child, your baby, and yourself. So, post pregnancy, you can lose that weight. So, don't be afraid. My concluding remark would be, don't be afraid about the weight gain in pregnancy.
Yes, just love your body. I mean, it's even in our regular lives when we are not even pregnant, there is weight fluctuation. This is such a big thing, like the most special part of a mother's life. So she must embrace it. Yeah.
Yes.
Dr. Pooja, we would like to hear your closing words as well.
As you both said, love your body, don't be afraid. Just, I would say, go with the flow, because not everybody gets a chance to embrace motherhood. There are many difficulties, there are many challenges, there are many stressful areas. So to go through every event every day is a challenge in itself. You never know how tomorrow is going to be, and how you're going to be today in those 9 months. And you're waiting for this precious moment, you and your spouse, and you're looking forward to have a family life. So embrace that positivity, embrace those blessings, and embrace that you are able to make it happen without any kind of a particular stress. Problems everybody has, but the motherhood instinct gives you that positivity to sail through. So follow your doctor's guidelines, follow your nutritionist guidelines, and rest, stay positive in your mind. I would say that.
Sure. Thank you, Dr. Pooja. Thank you, Dr. Archana. That was very insightful and full of positivity. I'm sure the viewers and any expecting moms or those who are even trying to conceive might surely picked up some very useful tips from the live session. That brings us to the end of the audience questions as well. And obviously, thank you, doctors, once again for joining the live and making it very insightful. Thank you, viewers. And that is it for today. Thank you.
Thank
Bye.
you. Bye.
Thank you. Bye.